Morning everybody, my name is Dr. Sean Morris. I am the owner of SNE Feedlot Consulting. Today we're going to be demonstrating to you how to do a transtracheal aspirate. Our practice has been doing these procedures now for over a decade, and it's a very simple procedure once you get the technique under your belt. And from these transtracheal aspirates, we are able to determine through a season, and in fact at the beginning and the end of the season, how the resistance profiles of the bacteria lie once we have completed our survey for a year. Okay, so the majority of the animals that would present with acute respiratory disease would be severely compromised in terms of their oxygen exchange, to put it very simply. So we don't want to apply too much pressure on the animal, okay, because that further compromises his ability to breathe. We absolutely don't want to apply pressure in the area where we're going to be flushing, okay, because that's going to limit his ability to inhale and exhale. So to perform the procedure, one doesn't really need to go very high-tech. A simple Menorah razor blade, a bottle of saline, a 20 ml syringe, an 18 gauge needle, and a Vigon catheter. Okay, this is not the normal catheter that we use. The normal catheter would be slightly longer in length. So all we do is we insert the needle slightly lower down the trachea so that we can actually reach the bifurcation. So you need to make sure that the animal is properly restrained. For that you need a very complicated piece of equipment called a nose tongs. And you need to make sure that the animal is aligned, that the head's not leaning either to the left or the right. Whopper, yeah. And the head must be straight for me, guys. Okay, you got it like that? You shave probably about a hand's breadth down from the larynx. Make sure that you get your margins fairly wide. And at the time of the TTA, one doesn't need to perform this on an aseptic basis. Make sure that you've just sterilized the area correctly. Nowadays, with sanitizing bottles being found everywhere and in any place, a simple spray with the sanitizing equipment, make sure that you're nice and clean. Okay, what's also important here is that when you're putting the needle in, it's got to be bevel up. The reason is if the animal jumps, okay, and the bevel's facing down like that, you're going to cut off the pipe in the trachea. So once you have gone through the skin, you're holding the trachea in either your left or right hand, depending on which is your dominant hand. You will feel the cartilage crack. And if you wish to practice prior to doing this on a live animal, you simply go to the abattoir and go and get a couple of tracheas. You'll feel the cracking, as we call it cracking, as you go through the cartilage rings. Make sure that the needle's not too deep. In many cases, you'll actually have the animal breathing through the needle. You then pass the catheter through the needle. Try and get it as close to the bifurcation as you possibly can. Okay, you're going to find the animal cough as soon as we administer the fluid. Administer probably somewhere between 15 and 20 ml of saline. Suck back on your syringe. You'll then find that the mucus that's now lying at the bifurcation will be pulled back into the syringe. Okay, you pull back. Right, so you've got an in situ needle. These needles are often used afterwards to control bloat in the feedlot if you're looking for something to stab the cattle. The procedure's done. This is the amount of fluid that you'll normally recover. We haven't found a lot of sort of flocculating material. So the animal is probably still in the early viral phase of the disease. But this will be submitted now to the laboratory, and within 72 hours, they'll come back and give us a result of what they've cultured. Write all the details of the animal on there, the temperature. There's enough space for you to write the details of the animal, the temperature. And what we also do is normally give the number of days on feed. That's an indication for the laboratory what they should expect to culture. In many instances, the antibiotics that the animal would have received would have been those of metaphylaxis. That's on arrival or may have been delayed, but the animals have never received therapeutic antibiotics. It's very important that we don't take animals that have received therapeutic antibiotics. We want a first time pull. This quick demonstration shows you that this is a really easy diagnostic tool to do. It just does take a bit of practice. If you wish to contact me, feel free to do so and I'll come and help you. Thanks.